under which the high-level panel is working. It's now my pleasure to hand the microphone to Madame Precious Matsoso, a member of the high-level panel and Director General of the Department of Health in South Africa.
Thank you, Secretary General Michelle Sidibe, Minister of Health, and good morning. 1 year after the AIDS conference, the Doha Declaration was adopted. It stated that in terms of the TRIPS agreement, countries should make full use of TRIPS flexibilities. The TRIPS agreement, in terms of the Doha agreement, declaration that was adopted, states that the TRIPS agreement does not and should not prevent members from taking measures to protect public health. We saw 3 years later the creation of initiatives to fund HIV, AIDS, TB, and malaria, the creation of the Global Fund, PEPFAR, WHO pre-qualification to facilitate access to generic medicines, Clinton Health Access Initiative, which was also instrumental in negotiating prices, and a whole lot of other initiatives. But we also saw in 2006 the creation of UNITAID, which was meant to also facilitate access. A creation of a number of countries, including Brazil, Chile, France, Norway, UK, as an innovative approach to health financing. But as we focus on sustainable development goals, we need to understand that there are still barriers to access which are still not addressed, but that we have to establish whether is the glass half full or is the glass half empty. In saying that it's half full, it means yes, a lot has been done, but more still needs to be done. MDR and XDR-TB require new products, and that means that we need investment in research and development. Pediatric formulations for children must be developed. It means that we have to look at smaller, very useful formulations for children, because children are not young adults. But we also saw the devastation in West Africa of Ebola, of a vaccine that should have been developed and wasn't. And more recently, Zika. So in essence, it means that there must be a mechanism by which we develop drugs, and there is funding, there is some coordinating mechanism. And that also, we have a way of prioritizing access. Now, these are ideas that have been floating and debates that have been going on for years. We've seen from Madam Dreyfus' report of CIPIH, we've seen through the Global Strategy and Plan of Action on Public Health, Innovation and Intellectual Property that was agreed to by member states. But there are still areas of work, and hence the need for this high-level panel. We need a right mix of policy option in this long walk that can help us not only improve access, but ensure that there's policy coherence between public health, intellectual property, as well as the rights of individuals to access care. Thank you.
Thank you, Precious. And now over to Lorena Di Giano. She's the